So, wellness IVs are offered at so many medical spas, and they actually do have a purpose. So, your skin is essentially a vital sign. If you are a healthy person or you're feeling well, your skin is going to show it. Just like your blood pressure, heart rate, and all the things that we call vital signs in medicine, skin is actually one of the same, it gives us the same information as any of those metrics. Now, when it comes to wellness IVs, what does it actually mean and which ones are effective and how do you combine them with skin? I think that is something that we can break down further. To understand how IVs and things, especially like NAD IVs, affect your skin and your body overall, you have to understand what inflammaging means. So, inflammaging, which is essentially inflammation that you experience more and more of with aging, is a concept that refers to our body's lack of efficiency in extracting energy from all our nutrition. And I know that sounds really sciencey, so let me explain that further. When you have a healthy diet, you naturally will have a healthier body, but that's because your body at the cellular level is extracting nutrients like antioxidants and nutrients that allow your cells to get energy. This energy helps your cells make new cells because, of course, we're all going through wear and tear as we go through life. Now, as we age, the part of the cell, the mitochondria, which you don't have to remember, but the part of our cell that helps our body extract the energy from the nutrients we take in, gets inefficient. It's just not as good as extracting that energy, which means that it's not as good as giving energy for all the cellular functions. In our body, the most important function we have is to keep our heart running, our brain functioning. So imagine as you go through life and your body's not as efficient as extracting energy. So no matter how healthy your diet is, you are actually not getting all the benefit of it because your cells can't extract that nutrition, which means that you have less energy to allocate in different parts of your body. And things like heart, brain, muscle, those are the most important parts of your body. So, unfortunately, as you age, your skin will get less of that energy allocation. And that's what we call inflammaging. And that's why when you want healthier skin, you do have to address it from the cellular level. So NAD has become really popular because it is actually a part of the chemical reaction that happens in our cells to extract energy from all the food that we eat. As we get older, remember that we are less efficient at doing that. So, when you add a molecule like NAD, which our body naturally has but has less of in the form of an IV, you can increase the extraction of nutrition and energy from the food you're eating. But the thing is, NAD is a very large molecule. If you were to take a tablet or some sort of oral supplement with NAD, your body likely will not absorb it. So, unfortunately, the only way to effectively get it into your body is through an IV where you have to come into a clinic, sit through about 2 to 3 hours to get an NAD IV, but that is not something you need to do on a very regular basis. So, you can kind of stack up all your NAD and do these kinds of wellness IVs every few weeks to a month, depending on how well you are. Okay, this is a fun question because a lot of people think that they will need IV infusions with any skin treatment they do, but that's not true. I have two favorite combinations. The first one is a combination of vitamin C and glutathione that you can combine while you're doing treatments that are collagen boosting, like PicoSure laser to reduce pigmentation or microneedling. Both these treatments cause an injury to the skin to trigger a new skin or new collagen building response. So, if you feed internally your skin cells at a cellular level with antioxidants like vitamin C and glutathione that we know are an important part of making collagen, making new skin, you will have an even better result. The second one is NAD. You know, NAD IVs are expensive. They take a lot of time. So when I recommend that to someone specifically for aesthetic or skin purposes, I'm a little conservative. I think it is worth considering an NAD IV along with skin treatments after you've had a long illness or your body is just depleted of energy. And that normally is not the case in my patients, but if I'm seeing someone who's been treated for some a chronic disease and now they're feeling much better and they want to look better, that's the time when I encounter these scenarios. And a series of NAD IVs, I like to do 4 IVs spaced 1 week apart and then proceed with all the skin treatments.